The aesthetic industry is fast evolving and rapidly changing. What we do today in facial injectables is very different to what we did 10, 15 years ago. Gone are the days of chasing muscle activity and freezing faces, and gone are the days of chasing folds and filling hollows and potentially filling a patient to distortion. We understand more today the concepts of facial aging, and we're understanding more the concepts of myomodulation, and we've got many more products on the market with different characteristics that we can use in different planes of the face. Where I see myomodulation is on the entire face, but where I see it most obviously is in the lower face. And when we've got weakness in the bone or in the fat from either the aging process, from facial habits or congenital weakness, we can restore in this area with facial fillers, which in turn gives support or mimics that bone or fat, supports the area, prevents the DAOs from pulling down, prevents the mentalis from internally rotating. And you also have your patients comment to you that they feel less stressed or they feel more relaxed in a certain area because the muscles are in better harmony.
Well, myomodulation can be simply explained as a levy system. So if we are looking at the muscle, how it's attached to a bone, and get that filler underneath that muscle to get it to pull and do the work of repositioning skin and tissue, that is what myomodulation is. An example like I can give is if we're looking at the mandible and the ramus, and our masseter is on top of that, as we age, we lose some of that bone here. Where that muscle now gets weaker, more flappy, if you will. So therefore, it's not supportive like it used to be, and things fall forward. So now if we got a product or filler underneath that muscle onto periosteum, causing this to pull back, that would cause pull back into to help our jowls. That would be myomodulation, using our muscle to bring it back to the original state that it was before.
Hey guys, you just listened to our wonderful podcast, and I promised you this YouTube video. So here it is. This is the full length version. So this is lateral zygoma. This is point number 1. You can see I'm going slightly higher than a 90-degree angle. I'm leaving, this is my voluma. I'm leaving 0.2 mLs right on periosteum. And you can see how I'm holding with my thumb, holding inferior, and I like to create that little contour. So that's point number 1. And then I just take my gauze pad, and Raj kind of does that a little bit more, but I push a little hard, and then you see I can kind of swipe back, and I take away that filler, and I kind of brush it back, and that helps to kind of mold the filler back. I'm wiping off her lovely lidocaine on her lips. Don't worry, I'm using separate gauze pads. So I'm doing a little Versa on her lips, so that's why she had numbing cream on that. So, and then the next point I'm going to do is apex. I'm giving her a little wand to hold onto. So, I switch my bevel to go up. So bevel's not down, bevel's up, and I'm doing her apex, and see how I'm going slightly. I'm holding my needle kind of higher, because wherever you're not my needle, the plunger of my syringe a little higher, because if you think about physics, wherever you're pointing that's where it's going. So if you push up, it goes down. You go down, it goes up. So I'm also doing a little lollipop injection, meaning as I'm coming out, I'm leaving a small linear thread, and that just creates a little support. And then see how you can twist. And it's cool with the Vicross things, you can twist them around. This one is now submalar. See how I'm coming lower? Anatomical considerations here are my transverse artery. See how I'm holding? I'm pushing up towards the eye. I'm aspirating back. You can see I pulled back until 0.2, no blood in the hub. I'm slowly pushing in 0.2 here. Boom, boom, boom. And then watch. This is going to really help that smile line area. And you see how I'm taking my finger, kind of massaging it in with Vicross. You want to make sure not to vigorously stimulate it. It's a bone. It's not intradermal. I'm not really concerned about causing a granuloma because I'm really deep. Now, this is the one that everyone struggles with, piriform aperture. See, I'm holding so nothing can swoop up to her eye. I'm going to bone. I'm making sure I'm on bone. And then I'm slowly aspirating back. See, I'm aspirating with my fourth finger there. That's a little trick. And then watch me slowly, slowly, slowly push in. No. And sorry, I'm answering questions in the background. I'm trying to make sure everyone gets this. And then I'm slowly, slowly, slowly pushing in. And then watch my thumb. See how I'm pushing in the filler?
Chin up.
And I just make sure I hold pressure for maybe about, I would say 20 seconds. Sometimes people are going through that facial artery. So what happens? You ooze. Now I'm coming back on the mandible angle of the mandible. You guys, I've been working my ass off the presentation. I'm exhausted. See how I'm turning my syringe? I'm turning my syringe so I can hit right on that angle. I'm laying here probably about 0.3 and I'm pushing really, really, really slowly because I'm leaving large aliquots. You don't have to do that. You can always push 0.1 or 0.2 at a time. So it's up to you. And then watch. See, I'm just molding it, molding it, molding it. Beautiful.
Doing okay.
Now I'm going to come back and do a little bit on the posterior angle. So you can see how it shows that nice little angle on her mandible now. You see how it sticks out? Now it's really, really transparent to me that I can see how her chin needs projection. So I'm going to come back here. See, I'm pulling slightly. I'm coming in that posterior angle of remember that ramus bone is very, very big bone. I'm coming right in the ramus. I'm going right into bone. I'm through the masseter muscle. Your masseter vein is there, so you have to be careful. You might have a little ease, but I'm slowly pushing in. Remember, this one has a really, really big vein, so you have to just make sure you're pushing really slowly. Remember, a venous occlusion is just as bad as an arterial occlusion. And watch, see, I'm molding, and then boom, you can see that. It looks beautiful.
Yes.
Now I'm going to take out her hair, clean my gloves, and let me see if I can split the video so I can keep explaining.
Put the vibrator over here. Good.
Okay, now I'm making the cleavage, and that cleavage is showing me, ooh, look, there's the volume loss. I'm turning my needle. I'm placing my hands on her mandible to make sure the filler doesn't go anywhere except for right where I want to go. I'm avoiding the mental artery, submental arteries, facial artery. I'm laying a very small amount of aliquots here at probably 0.1, and then you'll see that I'm actually gonna mold it. Watch, see how I kind of move the filler towards the front, and now I'm like, oh crap, I did a great job in the front, but now posteriorly there's more volume loss, and I need to add support there. Remember, just like what Rana said, you need to add support. So I'm adding more support. Sorry, that's my dog in the background grunting. Okay, so now I'm avoiding the mental artery branches, avoiding the submental artery branches, and now I'm adding 0.1, Kevin, more. Okay, and then this I'd rather do opposite than how much I'm placing. 0.3 is for large areas under the large masseter muscle.
Good.
Here, there's not a lot of muscle hiding this area. So here I'm doing very small aliquots, very small amounts, because there's not a lot of hiding here. Kevin, you gotta be careful. I'm trying to teach the people. Now the icing on the cake is the chin. I'm going between the submental arteries. See, straight in. Aspirating back all the way to the 0.2, and then I'm holding to make sure that my filler does not go everywhere. It's staying right under, right where I want it to go, and it's coming out. And then see how I'm kind of molding it. For a man, obviously the points are going to be different because the man doesn't want a pointy chin. So yes, for men, the points will be very, very different. Not very different. They'll just be wider, to be honest. So hopefully you guys enjoyed that and you had enough. Thank you.